So I thought let's start with Ford, if you'll introduce yourself.
I'm Ford Kessler. I'm a director of Beacon of Hope in Safe Harbor. And I won't go into the litany of other things that I do.
But they're all interesting. Peggy.
Oh, I'm Peggy Webster, and my background is actually affordable housing, financing of that, et cetera.
Thank you. Good to have you here. Mel.
Hi, I'm Mel Melmed, public health nurse, and I work with Olympic Community of Health.
And Gabby.
Figured it out. I'm Gabby Caudell. I'm the clinical supervisor, Believe in Recovery, and the RSAP program at the jail.
Thanks, Gabby. Greg Brotherton.
Greg Brotherton, County Commissioner.
Good. Matt Reddy.
Hi, I'm Matt Reddy. I'm one of the hospital commissioners at Jefferson Healthcare. Glad to be here.
Happy to have you. John Nowak.
I am John Nowak. I'm co-executive director of CHIP along with Lori.
And Cherish Cronmiller.
Hi, I'm Cherish Cronmiller. I'm the executive director of Olympic Community Action Programs, your community action agency for Jefferson and Clallam counties.
Thank you for being here. We have another Lori from Collaborative Consulting.
Hi, everyone. Lori, Collaborative Consulting, working with OCH, Mel and her team, and you'll hear a little bit more in a bit. Thanks for having us.
Good to have you here. Sheriff Knoll.
Hello, everyone. Joel Knoll, Jefferson County Sheriff.
Allison.
Hi, everyone. I'm Allison, and I'm also with Collaborative Consulting.
Good to have you here. Lisa Thomas.
Everybody, Lisa Ray Thomas with the University of Washington Addictions, Drug and Alcohol Institute.
Good to have you here. Jolene.
Jolene Crone, I'm the Deputy Administrator, Clinical Director with the Salish Behavioral Health Administrative Services Organization. Primary focus is crisis services across the 3-county region and non-Medicaid funding for behavioral health.
Thank you. Denise Banker.
Denise Banker, Jefferson County Public Health, coordinator of the Empowered Teens Coalition, Chimicum.
And Dave Fortino.
Hi, Dave Fortino here, jail superintendent with the Sheriff's Office.
Thank you. Vicki.
Vicki Kirkpatrick, Director, Jefferson County Public Health.
Thank you. Nat.
I'm Nat Jacob with the Public Defender's Office. Just a little bit of a advance notice. We're having some internet issues, so I'm going to turn off my video henceforth just so that I can reserve my bandwidth to hear all you lovely people.
Thank you, Nat. Chief McKern.
McKern Quilcene Fire and part of the South End Harm Reduction Plan.
Thank you. Good to have you here. Judd.
Hey, Lori, Judd Haynes, navigator with the Port Townsend Police Department.
Good to have you here. Elizabeth.
Hi, everybody. Can you hear me?
Yes.
Okay. Beth Myers, Matt Health Navigator at Jefferson Healthcare.
Thanks for coming.
Thank you.
Patrick Johnson. Or maybe Apple Martine.
Oops, I'm here. Hi, sorry.
Hi, Lori, I'm sorry. Oh, hi, Patrick Johnson. I'm with the National Alliance on Mental Illness, the Jefferson County affiliate.
Hi, Patrick. Nice to have you here. And Apple.
Hi, I'm Apple Martine. I'm the Community Health Director at Jefferson County Public Health.
All right. Have I missed anybody? Looking around. Okay, I'm going to move quickly over to some slides just to get through some quick announcements before we turn it over to Mel Melmed from OCH and her team. thought we might have Chief Olson here, who is the new police chief at Port Townsend Police Department. He is or has relocated with his family from Auburn, Massachusetts, and Auburn, Washington. And we are looking forward to having him engaged in the group and learning something about the priorities that he has for the police department. In terms of how our agenda will run today, we have a few announcements, and then we're going to focus with Mel Melmed and the Olympic Communities of Health to do a focus group on substance use disorder stigma that they will be working on to take into some action plan going forward over the next 6 months to a year. So before we jump into doing that, I just wanted you to have a quick update of what we'll be looking at in our next meeting. On the data subgroup, we have been working hard to set up and execute some one-on-one meetings that will facilitate some data standardization so that we can be comparing more apples to apples as we look at our incidents and how we're responding to them. And one of the other things that came out of our last meeting was we wanted to focus on how to measure and improve the referral success and the impacts of COVID. And then the third thing we were going to look at was how we could quantify the opportunity potential to connect with people or to connect the people with services as a result of some of the money that will be hopefully floating around with the updated State versus Blake decision and budget allocation. On the harm reduction front down in South County, Chief McKern is working with us on that group. We are going to be exploring the naloxone or the possibility of naloxone in the Quilcene School District at the Jefferson County Education Partnership meeting that happens on June 7th. And we'll have Dr. Carl Baum, who is the East Jefferson Fire and Rescue. Actually, I think he's all of the fire and rescue across Jefferson County. He's the medical director for that agency. So we're excited to have him both working with the group down in South County and to be making leading the exploration on our behalf. Also at the next meeting, we're going to be bringing in the sheriff's navigator and the sheriff and looking at how we can set up positive ways of education as well as how we are handling some of the encounters that we have going on. And then the third thing is we have one of the big projects that we have with this grant is looking at how we can put a client of our various services at the center of a model that deals with communicating with each other, bi-directional communication with each other about that one patient. And one of the things that we've been looking at is something called Unite Us. And we've just had one conversation, but we're excited to finally be starting on looking at possibilities of how we could make that happen between us here in this county. And then I wondered if Denise could talk a bit about how the drug take back day went.
Well, it was the only day that we've had rain from start to finish in about 2 or 3 months, but it went really well. Sheriff Knoll and I took back 9 boxes of unused over-the-counter and prescribed medications, no questions asked. And we had about 149 people who showed up to drop off medications, and we sent back to the DEA for incineration 354 pounds of unused medication that is no longer in the medicine cabinets of folks in Jefferson County. So that felt really great. And I'm always super thankful to Joe for partnering with us on that. And we actually can't do it without a law enforcement partner because it's illegal for me to just take those drugs back. At least we think so. And yeah, it was great. I mean, we do it twice a year. We do it in October and we do it in April. And we will be doing it again next year and probably likely in 3 locations, Quilcene, Hadlock, and Port Townsend.
All right. Well, thank you very much, Denise. It's good to know that program is going so well. Sheriff Noel?
Yeah, it did go really well. And just to let everyone know, the DEA actually reaches out directly to me. And all other counties, you don't need to have law enforcement there. But since it's Denise, they want to have the sheriff oversee it.
I see.
That's a joke. Just kidding. It was really
I'm looking to see if people are smiling.
Yeah.
So my reputation precedes me.
Yeah, no, it went really well. And all credit goes to Denise and her crew. I just have to stand there. So good job.
Well, you do your job well, Sheriff Noel. Okay, and then quickly, I wanted to have Lisa give us a little bit of an overview of an event that she has coming up. Lisa Ray Thomas.
Well, thank you so much, Lori, and everybody. And wow, every time you start off these meetings, you have accomplished so much in the month prior. It's great. So I will put in the chat box the link to the flyer that Lori just had up there. We're hosting our second Transforming Our Communities, Supporting People Who Use Drugs, afternoon of June 29th, morning of June 30th. And we'll have 4 tracks on June 30th. One looking at harm reduction approaches to working with people who use stimulants. One on the role and importance of housing and housing support services when supporting people who use drugs. One on reducing stigma and equally important, increasing compassion when serving people who use drugs. And one looking at the rise in fentanyl use in youth. So thank you, Lori, and thank you, everybody. Hope to see you all there.
Thank you, Lisa. It sounds like a really interesting event. You know, I wanted to ask Peggy if she would tell us a little bit about a fatal overdose that had happened in our community just before we walk into the focus group. Thanks, Peggy.
Sure, just real quickly, a young man at his bachelor party on Saturday, he was to be married in 3 months, overdosed. Cocaine apparently laced with fentanyl. Also interesting is that this young man was a local guy. He, about several years ago, he was part of a Washington Conservation Corps crew that worked for the North Olympic Salmon Coalition. And of the 5 kids in that crew, 2 have died of overdoses in the last 6 months. So, you know, if we don't think there's something to worry about, there is something to worry about. So.
Thank you, Peggy. Are there any questions before I turn it over to Mel and the next part of our agenda?
See, Laura, did we get that link to the transformation conference?
I'm just about to paste it in the chat.
Oh, I'm too eager. Thank you.
Thank you, Patrick, though, for following up. Okay, well, if there are no other questions, thank you all for being here, and I'm going to turn it over to Mel and her team.
Great, thank you, Lori. Hi, everybody. So Olympic Community of Health was awarded funding from Cambia Health Solutions to explore and reduce stigma of substance addiction across the Olympic region, which is Clallam, Jefferson, and Kitsap counties, and the 7 sovereign tribal nations that are in that region. So stigma we're defining as a negative and often unfair social attitude attached to a characteristic person or group that can lead to unfair judgment and treatment by others. The first step in our project is to better understand stigma and the local impact that stigma has on individuals and communities in our region. Olympic Community of Health has engaged with collaborative consulting to conduct focus groups, key informant interviews, and community-wide survey to gather insight into addiction stigma in our community and the problems that stigma may cause. And also we want to learn about ideas to address stigma. What I want you to know too is that it doesn't stop there. The findings that we gather from all this will be used to identify and implement strategies to address and reduce stigma in the Olympic region. So today is sharing. This focus group is one of a series that we're offering in May and June. There are 3 that are open to the public. 1 happened this morning. One is tomorrow morning and one is in the future. And you can find information on that on our webpage. I'll put it in the chat towards the end. So I thank you so much. We have 45 minutes together today to discuss a lot. We're asking you to share your perspective. There is no right or wrong answer. We value all the perspectives that are here today. We will be taking notes and saving the chat log to identify key themes from this session. All the information that you share today will remain anonymous. So we will use information to produce a report that synthesizes across all the focus groups and surveys. We will not attribute anything to individuals or to any specific individual. So with me today, I have Lori Peterson, who will facilitate the focus group, and she's from Collaborative Consulting, and Allison Berger, who will be behind the scenes helping with timekeeping and some other pieces. So with that, I'm going to turn it over to Lori.
Thanks, Mel. Hi, everyone. And as Mel said, thank you so much for taking your meeting time and allowing us to ask a few questions. As Mel mentioned, we're going to cover two areas. One being the impact that addiction stigma has within your communities. And then the second being ideas to address addiction stigma, leveraging community strength. So those are the two areas of focus, and we've got a few questions within each of those areas. And we're going to do this in a couple of different ways. One, I'm going to start with those questions and we're going to do large group discussion. And then second, we'll do a quick chat activity. And then third, we'll leave you with a survey to take if you'd like to take the survey. We'll leave a little bit of time towards the end. Because there's a pretty large group here and we've got multiple questions, it might happen that everyone doesn't get to answer every single question. In fact, I'm pretty sure that will happen. So we really are encouraging you to use the chat. So if you have a thought and somebody's talking, or you have a different perspective, or we didn't get time to get to you, just please throw it in the chat. As Mel said, we're going to be keeping those notes and we're going to be synthesizing across multiple focus groups. Let's see. I'm trying to think if Mel, did I miss any? Oh, I know. I did miss one thing. When you want to comment, weigh in, if you could either literally like raise your hand, or use the little icon down here at the Zoom thing, the little hand raising. Allison and Mel will both help me keep track. And again, we're going to try to get as many perspectives as possible into the conversation. And with that, before I launch into my first set of questions, does anybody have any questions for us around what we're doing and what we hope to achieve within the next 40 minutes or so? Okay, I don't know, I see some heads, so I think we're all good. All right, so for my first question to the group is, how do people with substance addiction experience stigma in your community? So how do people with substance addiction experience stigma within your particular community?
Okay, I have a question.
Yeah, Joe.
Are we supposed to write it in the chat box?
Oh no, you can write it in the chat box, but also this is a time for verbal discussion. So yeah, go ahead and raise your hand, jump in, and we will. This first round, thank you. This first round is verbal conversation, but you are more than welcome to use the chat if you don't want to speak out loud. But I'm really hoping that somebody talks out loud for this part.
I guess I'll start by saying.
Okay. All right, great.
With housing and employment, a couple things.
Great. Patrick.
Yes, I'm old enough to remember when we had what were called the town drunks, and Port Townsend's pretty small, and I think some people who are struggling with substance abuse are known around town for that, and sometimes in a joking kind of fashion, but most often I think in a tragic sort of way. So clearly they're they have a reputation as struggling with substance abuse.
Mhm. Would you be able to offer, if it's appropriate, offer an example of how stigma plays out in those certain circumstances, especially like you said, with a very small community and lots of people know folks and.
Well, I think what happens is that they're not invited to social events in particular. For example, if they do come, I think that people point at them, other people point at them and talk about them. I think their value as human beings, if I may, is diminished, and their other talents and contributions and role in the community is overlooked because their substance abuse issues transcend all of that. And if they do go into recovery, I'm not always convinced that they are lauded for that and recognizing that. People don't do it because they want accolades. They do it because they want their life to be better, and their life is not better if they're abusing. But it's very difficult, in my view, to overcome stigma sometimes as an individual who is abusing whatever substance it is. And then there's almost a self-fulfilling prophecy, particularly with drugs. Oh, once you're a drug user, you're always going to be a drug user, and you'll never get out of that. And that's how you're viewed.
Great, thank you. Those are very good examples. Thank you. Is it Pegster? Or is it, I'm sorry. Peggy? Okay.
My daughter did that.
I do like Pegster though, but please.
So your comment about a small town, I will give you an actual example. A year and several months ago, my son was in heroin withdrawal, and he was here. We said, let's go to the ER. We tried to go to the ER, but someone he knew, her mother was the ER nurse, and he wouldn't go in. So sometimes your solutions or your places to go are limited because of it's such a small town.
Okay. All right. Thank you.
I have an example as well, and I'm sorry again for my lack of video.
Oh, that's okay. Is that Nate or Nat?
Nat, yeah, thank
Nat,
you for
okay.
asking.
Great.
So I think that one thing that I've noticed with my clients is that there's a sense of dread or despair about not being thought of as reliable in the future, even after somebody has overcome an addiction or is, has a X amount of clean time, feeling that the community will never really accept them for anything other than somebody who's unreliable and can't be trusted.
Great. I'm appreciating how the group is talking a little bit about like the experience of stigma at the internal level, but also at the external level. So I'm appreciating that perspective. Anyone else would like to weigh in around how do people with a substance addiction experience stigma within your community? Denise and then Beth.
I think they're actually ostracized, and maybe some of it is self-ostracization. But like at community events, say 4th of July event at Fort Worden, or Dance on the Dock type events, I think that they don't feel welcome, and so they don't show up. And if they do show up, they're avoided.
Great. Beth, I think you had your hand up, and then Patrick, I see your hand up too. Thank you. Beth.
I've noticed in my short time in this community.
Oh, Beth, we can't hear you very well.
There.
Oh, much better.
Thank you. What I've noticed with some of the people that I've worked with in this community is whether they're continuing to use or trying to be sober, they have fear from past experiences, and that fear tends to prevent them from stepping out and becoming, trying different things and becoming who they are. They're just fearful, and they stay sort of hidden And yeah, so they have trauma from past experiences.
Patrick.
I want to let you know you have comments as well.
Okay.
In the chat.
Great. Thank you. Patrick and then Apple. I saw those two hands, and then we can take one more, and then I'll move to the next question.
I just wanted to add a description to what Beth and Denise said. It's people who are ostracized are driven into isolation, which just exacerbates their challenges.
Yeah. Apple, did you have a comment?
I do. One thing that I experience in my work and working for and with the public is it's an assumption of fear on the part of the person interacting with the other person that's assumed to have a substance use issue or mental health issue. You know, fear drives almost everything we do in some way or another. And I am just really curious about more courageous conversations with people on the part of the person who's not suffering from the addiction, but it's a tall order and it takes practice. But I'm really committed to figuring that out. I find myself drawn to people who are stigmatized in that way, at least in the context of my work generally. But I have lots of colleagues and staff who, you know, naturally have a lot of reactivity, concern, sort of already dialed in notions of such people. And I just think there's a lot more conversation to have about it among those of us who are, you know, representing the help in the community. I think we're all in it for the right reasons, and we all have our various arcs of understanding and training that we're on in our professions. But I would love to see just more present conversations with people who you actually may have bias against. You may stigmatize them yourself, but I would like to see that happening more across the people that I know. And you know, they're all courageous in their own ways, but everybody has varying levels of ability to interact with folks who are struggling in those overt ways, but
Well,
also the less obvious ways.
Yeah. Save some of those thoughts, because we're going to get into some of the ideas too. Before I'm just conscientious, again, this is the part about the time and having multiple questions. Before I move to the second question though, is there anyone else that wanted to add anything around how people with addiction, substance use addiction, specifically within your community, experience stigma? Is there anything that I know there's a lot, but is there anything that you really want to make sure that gets said and gets noted before I move to the second question? Okay, Allison or Mel, any clarification that you need before I move to question 2? Okay, great. I know Allison's also rapidly trying to take notes, so I want to be conscientious and make sure you're capturing everything. All right, so my second question is, what are the biggest problems? And a couple of you already started to jump into that arena, but formal question here. What are the biggest problems that stigma related to substance addiction causes in your community? Ford.
I think one of the biggest problems that we have is people's personal biases based on their past dealings with substance abuse users and stuff like that. You know, they might not even be aware of how much their past has influenced their ability to work with other people that have substance abuse disorders. And so as a result of that, they ostracize them, close them off. They'll let them be a part of it. And sometimes they're even openly aggressive and angry and upset with them. So I think until they process their own feelings and past histories, they're going to have a block to working with people with substance use disorders.
Mhm. Thank you. Others have, Lori, I see your hand.
One of the things I was thinking about is, in response to, anybody who has inadvertently taken fentanyl, you would like everybody to know how to test their drugs for fentanyl. But in a community or probably any community where you're worried about how people are responding to information that you're putting out there, some people might perceive to put it out there would be to encourage drug use. And so there's this constant yin and yang to what's the right response. Is it to educate crazily or to not, because now you're just opening their awareness.
Mm-hmm. Mm-hmm. Denise.
So I'm thinking about the party crowd, and there's a lot of acceptance of partying and partying lightly with various kinds of drugs as well as alcohol, and then there are folks who cross the line at the party. They're known as the one that's wearing the lampshade, and so I think that what happens there is that the party crowd actually ostracizes one of their own because that person has crossed the line. And so I think that what happens there is this odd combination of, hey, there's nothing wrong with this. It's just some people can't handle it. And so, alcohol involvement, marijuana involvement, and marijuana is a different animal than it was when I used marijuana, but and cocaine, et cetera, it's laced with very dangerous things. I don't know if it was in the past, but at any rate, there's this sort of, well, we can handle this, but there's these people who can't handle it. And they're the ones who are the problem, not us. I mean, don't question me about my drinking, for heaven's sakes, and how it influences the behavior of young people in my community. So I think that there's a disconnect, and I think we inadvertently encourage substance use on some level by our own behaviors as adults.
Thank you, Denise. Others around barriers or challenges that individuals face within your community as it relates to substance addiction and stigma.
And I want to let you know again, you're getting comments in the chat as well.
That's great. We can have, yeah, thanks, Mel. I see a hand, Judd.
Sorry, there we go. I'm trying to say this succinctly. I think one of the biggest problems that I've recognized is that regarding stigma is it's just two camps. It's kind of polarized. It's either someone has no issues or other types of issues or substance use issues, and it's not really perceived on a spectrum, which to me also leads to not necessarily the biggest problem, but also that there is the catch-all resolution. All this is send them to treatment, and the treatment providers here could probably speak a little more eloquently than I could about just physically getting someone into treatment doesn't mean they're going to be cured, that their problems or whatever the case may be. I mean, it's extraordinarily complex, and so I think oversimplifying it and the ease in which I see a lot of people, even providers, saying like substance use, non-substance use as the dividing line versus, again, the complexities within it. So
Thank you. That was very succinct.
Yeah, going off of,
yeah, no, I think I saw John's hand and then I heard Nat. So Nat and then John.
Oh, well, great. I get to go ahead of John.
I think that was the order. Apologies, John, if it wasn't.
He's okay. Well, I just going off of kind of that oversimplification that reading between the lines of Judd's comment, and I know Judd deals with this every day, but this notion in society at large that, you know, that you just put somebody in treatment. We need to just, you know, expand treatment services and that will solve the problem of drug addiction in our communities. You know, there's some truth to the fact that treatment services should be expanded, no doubt, but Judd's right that there's I think it's an easy way for people who don't know a lot about drug addiction and you know how it really works physiologically and socially. They don't realize that it's not as simple as just putting somebody in treatment. And I think as it relates to stigma and kind of the way people experience stigma, to answer the question, I think that is frustrating for those who are dealing with drug addiction and those who are advocating on their behalf and treating them, to see that oversimplification play out time and time again, because then I think it becomes internalized in that person. What's wrong with me? Why can't I, you know, just do this thing that I now have access to, etc.
John.
Yeah, I think several people have spoken to the kind of the social isolation that comes with substance use disorder. But I think the downstream effect of that social isolation is that it makes it more difficult for somebody to get plugged into any services that might be able to help them. And I agree with what Nat said. There's not a magic wand out there that you can pass over, but I think a good starting point is to get people plugged into services that might be able to either do harm reduction or actually begin to treat their substance use disorder. But when you're so socially isolated, it is really challenging to have the contexts that allow you to be able to do that.
Okay, thank you. And thank you everybody, Mel, for acknowledging who's putting stuff in the chat. I have to move to the third question, but before I do, Peggy, you had your hand up and did you want to have final word on or final comment on the second question?
Well, I just wanted to support what Judd said, and I think it was Nan about the, my son has been in two of the best psychiatric institutions in this country, and their success rate is 10%. And he went to Grey Wolf. And by the way, there's a whole alumni of Grey Wolf in town. And it doesn't get cured, especially if it's coupled with any kind of mental illness disorder. And it's very complex.
All right, so I'm hearing some of this already, and I know these questions kind of start to blend together. This question gets a little bit at thinking about kind of the layering, or maybe some folks might say root cause, but why do you think stigma exists in your community?
Fear.
Fear, and then Cherish, I see your hand up.
Yeah, I mean, I think stigma is one of those things where Apple's right. I mean, it's a way, just the way we compartmentalize individuals as we try and deal with our own like cognitive dissonance of how do I interact with this other human being? And if I perceive them as a threat or as a threat to the social order or the social good, then subsequently I want to banish that from this, especially, as I think about, Port Townsend and the peninsula, this beautiful, pristine place, right, where people just want it to be a dream all the time, where this is where people go to escape and vacation and holiday. And so subsequently, I don't want to be faced with this reality of, what exists in our society. And so, it's people's own way of dealing with that cognitive dissonance and trying to shield themselves from that fear.
John, how about from you, your perspective on that?
Yeah, I just want to kind of second what Cherish said, and kind of, I often think there's kind of two Port Townsends. There's the one that, the well-off, you know, connected people in the community experience that, you know, everything's going great and they're doing fine and they have the financial and other resources to do fine. But I think there's another Port Townsend that a lot of us don't experience. You know, some of the people in this room certainly have, but a lot of others in our community don't see or experience. And because they don't, they can't relate to those people in any way. And, you know, that's where that stigma comes in, because they only know the wonderful Port Townsend that, you know, that people have enough money and have enough resources to do what they want. And they don't want to know about that other side. And that makes it challenging.
Thank
Lori,
you. I see
Vicky's
Vicky.
had her
Yeah,
hand up. Okay.
thanks. I finally saw the little yellow thing. Vicky, thank you for waiting. I didn't see it. Yeah.
It's okay. I think it's also related to, somebody said in the chat, lack of knowledge and experience or understanding. And I think, you know, there is a general lack of knowledge about the impact of trauma in people's lives. And there's sometimes we are, a society can be quick to judge and equate substance use with crime. That if you are a substance user, you are the ones who are committing all of the property crimes and other crimes in the community. And there is a lot of assumption that occurs around that. And even if there has been criminal involvement, there is a lack of understanding about the impact of trauma, and trauma is huge. I would love to see a trauma-informed community.
Great. Thank you, Vicki, and thank you for your patience. One more forward, final words on this question, and then we'll move to something else.
You know, a lot of what I'm hearing would tend to lead me to think that we're talking about the homeless and the people that are at the bottom rung of substance abuse issues and stuff. And it could be somebody on this screen that has the same problem, but because they're in a successful position or they're in a leadership position, we overlook that because we think they're successful and they can't have a substance abuse problem, and that's not true. And I think we need to broaden the scope of understanding of what addiction really is so that people will have better insight into what it is and how to deal with it.
Great. Thank you. That leads me to, that was a very nice transition in the next few minutes. So kind of a shift, a little bit of shifting gears or shift in thinking. We've been talking about some of the challenges, the problems, why does it exist? What are some of the barriers? And so now we would like to shift over to what are some of the ideas in addressing stigma in your community and in utilizing those strengths. And the way that we're going to do this is through a chat activity, and it's going to go pretty quickly, but I'm going to ask the question, and I'm going to ask you just to write it, but hold for a moment. And then when I say enter, then send enter, and all the comments will come at once. And please take a moment to start reviewing them as they're coming in, and we will be reviewing them too. So I'm going to ask the question, type in your response, wait till I say enter. And if you don't, it doesn't matter. And then we'll take a look, and we're only going to do a couple questions, and then we'll close up because I know we're getting short on time here. So first question to the group: what is working well already to address or reduce the stigma of addiction in your community? So what is working well already to address or reduce the stigma of addiction in your community? This is, put it in the chat. Now, whenever you're ready, go ahead and hit enter. And if you're still typing, that's fine too. All right. I'm seeing some recovery cafe, educational PR, drug court, gatherings on the issue often and regularly. Talking about it is helping. We need to talk lots more. Community conversations should be ongoing. A couple people have said that. The consortium, CHIP, graduates, and education. And I know I missed a lot here too. Thank you. All right, second chat question. Same exercise. I'm going to ask the question, put it in chat, and then I'll say enter. What ideas do you have to reduce or address stigma in your community? So these could be new ideas. They could be building on things that are already working. But what are some of your ideas to reduce or address stigma in your community? And go ahead and hit enter if you're ready. Permanent supportive housing, public education, more open conversation, stop glorifying drinking, work with employers, more wow, these are some great, more outreach and programs, non-hierarchical circle to allow open dialogue, healthy safe spaces, opening all discussion, reminding each other to use respectful and compassionate language. Okay, I have time for one more, so I'm going to go ahead and go for it. And I'll make it fast so we have time to get you to the survey. Last question. Same exercise. What are strengths and assets in your community that can be leveraged to address stigma? So what are the strengths and the assets that the community already has that could be maximized or utilized to address stigma? And just go ahead and hit enter whenever you want, since we're getting down to the wire. I'm seeing some really good people, liberal, open mindsets, accepting community members, willingness to try new things, good base of collaboration. Great. Thank you. Does anybody have one final comment before we move to the survey? We're going to give the last 10 minutes for the survey, but I know this was the pace was maybe a little bit rapid. I again want to thank you for your time, but any final comment or closing words from anyone? Patrick.
Yeah, two things, and some folks, excuse me, are getting to this in the chat, but it's a combination of science and compassion and empathy and caring. But the treatment needs to be based on science, on data, the kind of thing that we're doing here with the community health improvement plan and all of that, and then surrounding that with compassion, empathy, and caring.
Thank you. I think those are good closing comments. Ford, I'll give you one more closing comment.
Yeah, I've been in this field for working with alcoholics and drug addicts for over 40 years. And to be honest with you, I'd much rather work with them than some professionals. So, you know, sometimes it takes a lot to get a person to get to the point where they can accept the fact that they have a substance abuse issue and deal with it. But, you know, we can't give up. We can't quit trying because we can turn people's lives around. and help them. And I've been sober over 40 years, and nobody in this community has ever seen me drunk, and you probably never would want to. I'm not a nice guy when I drink, but there's a whole lot of people in this community that are sober and clean, and they have turned their lives around. And if we reach out to them and draw on them as a resource instead of that continued pushing them away, we might be a little bit more successful.
Great. Thank you, everyone, again, and I really appreciate you allowing us to come in on your regular meeting, and I really appreciate the work that everybody's doing in this area. The one last thing that we would like to invite you to do is to take a survey. And Mel is going to put the survey in. This is anonymous, by the way, and this has gone out in the OCH newsletter. And again, it's another way for us to collect information and insight. And so Mel is going to put the survey link. It's there in the chat. I'm going to. Allison and I will stay on for a couple minutes just in case anybody has trouble accessing the survey, but otherwise we will jump off and I'll let you close your meeting out. Mel, anything that I forgot that you want to say before folks start to take the survey and we jump off?
Thank you very much, everybody. Really appreciate your time and your perspectives.
Are folks
Lori?
able? Oh, have somebody saying something, but I can't see you.
It's
Oh,
Lori.
Lori, okay.
I wondered, how long should we allow for that? Is it a 10-minute survey or a?
It takes about 5 to 6 minutes.
Okay, so we'll give
So-
5 to 6 minutes and then we'll.
Yeah. So we'll jump off, and then that way, Lori, if you need to close your meeting out, but if folks want to take it now, we thought we'd leave a little bit of time because we thought by the time you go back to what you're doing, the survey will get kind of lost in the shuffle. So if that's okay, we'll jump off. And does that work, Lori?
Yes, that works fine. So we'll give everybody 5 minutes here to get at least the majority of that survey done, and then we'll come back and do a quick closeout.
Great. Thanks, everybody. Have a good rest of the week.
Thank you so
Bye-bye.
much.
Thank you.
I had to put myself in a new age group.
That means happy birthday.
It was discussed at another meeting.
You can't get away with that with me. I love birthdays, so happy birthday.
Thanks.
Okay, I'm going to give one more minute. Okay, thank you all for your time and attention. It's the first time we've ever done that, and I appreciate everybody sticking with us for the whole session. Mel, thank you for running a really well organized setup here. I wanted to remind everybody we're going to be submitting another quarterly report at the end of June. So I'll be reaching out to some of the key stakeholders here to get data and sort of your top challenges, have that same conversation we had last quarter. And I wanted to ask, are there any questions or anything that you want to share before we take our leave? Scanning.
I just want to express my condolences to your community for your loss.
Thank you. Thank you. And thank you, Lisa, for noting how good Judd's language is and how we can all emulate it. I really appreciated that. It's good to have somebody who's really got an ear for that. Okay, so go forth. Everybody have a great afternoon. We're going to see some of you in our next Zoom meeting, which is the working age group. Have a great week.
Thank you.
Thank you all for all that you do.